The pictures, the stories, your world. Nicelle Madina, Dan Cohen, and weather with Natasha Stenbach. You're watching News 8 at 7.
For more than a decade, silicone breast implants have been off limits to women who wanted cosmetic surgery. Now the FDA has lifted that ban. Joining me this morning with details is local plastic surgeon, Dr. Soltero. Thanks so much for your time this morning. Now, the controversy really started in the 80s, but they weren't pulled off the market until about 1992. What were some of the main concerns in the first place?
Well, the whole issue with silicone gels was the fact, the liquid inside of them, okay? The problem was that to make the implants as natural as possible, they made the shells as soft as possible, and the liquid inside almost like it was oil. So what happened? The implants itself, with time, the shell would give up, and the liquid would just permeate out, creating problems because the shell that the body forms around the implant is permeable. So then the liquid will, seep to other parts of the body.
And you talked about problems as in health problems.
Sure, absolutely. People were having hardening around the breast. All the studies showed that there was no correlation with any autoimmune diseases, any other diseases that were talked about. All the studies that were done by the FDA afterwards showed that there was no correlation between one and the other.
So did any changes have to be made for the FDA to go ahead and approve them to be available back on the market?
Absolutely. The implant that's used now is 1,000 times better than the old implant. What I'm talking about is a cohesive gel, which means the following. It's an implant that's like Jell-O. If I cut that implant in half and I hold it upside down, it would stay together. Now, it's almost impossible that implant's going to rip in half. The key factor to understand is that there might be small cracks. And in a small crack of that type of implant, the gel is not going to go anywhere. That's a huge advantage for the patient because now you have an implant that's soft, that's pliable, that is 1,000,000 times better than saline. It would last you about 20 to 25 years compared to a saline implant.
Now, I understand that there are still guidelines and rules that the FDA is requiring surgeons to go by if a patient decides to go ahead and use this. What are they? What are some of the restrictions?
Well, the guidance is fairly specific. First of all, the patient needs to be at least 22 years of age. The patient needs to basically understand that she's going to be using a device that's still, a little bit understudied.
Right.
However, there are no parameters from there on. The key factor is that the patient goes to somebody that knows how to put these implants in. There's a big difference in putting a saline implant or a silicone gel. A silicone gel comes in and you have to make a little bit of a wider incision. You have to put it more gently. A lot of the times what the studies have shown is that people that are not familiar with the implants are putting them in, they're putting too much excessive force, trying to put an implant through a smaller incision and creating some damage to the implant itself before you put it in. You don't realize what happens, and then there could be a small leak.
Now, real quickly, do you feel comfortable using them, and will you use them on your patients?
Oh, absolutely. I've been using the implants for about 7 years. I was part of the study that actually helped to get these implants approved.
Okay.
So the key factor is to go to somebody at least that has experience putting them in.
All right, and make an informed decision if you do decide to do any type of surgery, because again, it is a foreign object going inside your body. Dr. Soltero, thanks so much for your time this morning. We appreciate it. For more information on breast implants, just log on to our website. That is kfmb.com. We'll be back at 7:25. First, we're going to hand things off to the early show for